That Naturopathic Podcast. TNP.
Hello there.
Hi, and thanks for joining us. I'm Dr. Michelle Pobega, naturopathic doctor.
And I'm Dr. David Miller, ND, and we hear your frustrations. This show is for you.
This show is for you if you're feeling like your current healthcare strategy is not getting to the root cause or the underlying reasons for your health.
This show is for you if you've been told that you're fine, but you definitely don't feel very well.
This show is for you if you're walking out of your doctor's office with 1, 2, 3, 4, or even 5 medications without any mention of diet, lifestyle, or a long-term game plan.
This show is for you if you've got several specialists taking care of you, but no one is really putting all the pieces together.
This show is for you if you believe that health should be part of healthcare. These problems have solutions.
We know it.
Our patients know it.
And we want you to know it.
Naturopathic medicine is the solution that you should know about.
Welcome to another episode of That Naturopathic Podcast. Dr. David Miller, ND, with Dr. Michelle Pobega, ND. What's up, Michelle?
Michelle?
Yeah, I got marbles in my mouth.
Maybe your tongue is too big for your mouth and you have a B12 deficiency.
Ooh, glossitis. Bam.
You know what? Actually, that
there.
came up once. I had someone that I worked with and he asked me, he was like, my tongue feels like there's this weird burning sensation and it feels weird in my mouth and blah, blah, blah. And then he was like, should I go to my doctor? Is this a concern? I said, you could start with something simple and just supplement with some B12 lozenges and let them melt under your tongue. And within like a few days, he was like game changer. And it was because he had, so we're going to talk about B12 today, guys.
Because you were listening in class one day at Naturopathic College and remember that
one day?
Yeah.
That one day I was listening. It was very appropriate.
One of the few days we learned something that we didn't learn after school, but never mind.
But it's a great symptom indicator, right? Or if I see people with like big tongues, inflamed tongues, or if they have a weird tongue burning sensation, then I automatically start to think about a B12 deficiency. And I have a patient that has that, but we're trying to remedy a few other things because there's a list of chronic health concerns happening there. And there's only so many pills I can consciously throw at somebody at a given time. So, but I'm pretty sure
real for that.
Yeah.
You know,
like the amount of things that I take is
handle?
ridiculous. And I'm kind of like, it's one more. And then I get supplement fatigue too. And I was like, and I know most people are not used to having to factor in these types of things like I do. But anyways, back to B12. We're going to talk about it because it's pretty glorious as a vitamin.
Yeah, and the idea here, guys, is we're just going to dedicate like 15 or 20 minutes to B12. You could dedicate like 15 or 20 hours to it. I think it's again, like just the podcast is great for going back and just reviewing stuff you thought you knew, and then you know it a little bit better. Yeah. And this has been another one of those humbling times. You're like, let's quick do a podcast on B12. I'm like, oh my God, let's do a PhD on it. Yeah. We'll do 15 or 20 minutes of just like B12 love.
So B12 is actually, the name is cobalamin, and it's basically involved in a lot of reactions as a cofactor and as a coenzyme is wildly important. Number one, it's involved in DNA synthesis. So that's kind of a big deal. And I just want to emphasize that. It's involved with methionine synthesis from homocysteine. It's also converted to succinyl-CoA, coenzyme A, which is part of our Krebs cycle, which means it's part of your energy production. At the attendance at the conference that I went to, they were also talking about, using a methylated form. And I'm going to get into that a little bit more because B vitamins in the methylated form are extremely supportive of our methylation pathways, which have a lot to do with helping regulate inflammation, detoxification, immune health, glutathione production, cell membrane function, carnitine shuttling, metabolism of histamine. Again, going back to like DNA methylation of like gene expression and stuff. It's not a joke when Michelle, it comes to this. Yeah.
Just a quick add to your comment on DNA. Yeah. Methylation is what can turn genes on and off, and methylation is the most common reaction that's occurring in the body day to day.
Right.
So that's just adding that to you not only in the cell division, but then the control of rates of division.
Well, here's what I want to say. Even though this is a conversation about B12, I would be remiss to not bring that factor in and just make a tiny little point about folic acid and folate. Folic acid is a synthetic version of folate, and it requires conversion, and you need methylation factors and all these things. So it turns into the correct version of folate, which is the active form. And a lot of, medical professionals are still following outdated versions. And I get a lot of women coming to me saying, oh, I'm a high risk pregnancy. So they put me on 5,000 of folic acid. And I was like,
Yeah.
did they put you on B12? Because the modern research shows that you need B12 to facilitate folate, but it's also going to be even more imperative if you're getting a synthetic folic acid, you're going to need that B12 to help the conversion to the active form. And why not just bypass that and go right to the active version and still supplement with B12? Because you need both for good DNA support, because both of those are going to be essential for methylation and all those other things that I just listed off. So I just wanted to put that out there, because I don't understand why people are still recommending folic acid after everything we have learned, and it interferes with like your methylation pathways in a pretty big way. So anyways, ta-da.
Yeah, I'm glad you brought that up. I kind of forgot about it because, like you said, it seemed like old news, but it's not old news when
It's
you
not
see
old
what's out
news.
there. So
It's still a problem, right?
yeah.
And just high doses of it, 5,000 of folic acid. And I was like, dude, we gotta change our approach to this. So I always put them on like a folate B12 blend. And if they still want the high dose, they could do that. But at least they're getting the right forms and they're getting the right pairings. So, because nothing works in isolation, let's be real.
Yeah, exactly. But you know, with this vitamin, like, so we're talking about some pretty heavy stuff. We're talking about genes, like the making and dividing of cells, gene expression, blood formation, and
Right?
neurological spinal cord neuropathies. Like, man, it's a heavy hitting
Yeah.
vitamin that you don't want to you really don't want to be low in.
No, like there's also been some research to look for its therapeutic use in like things like breast cancer and chronic fatigue syndrome and psychiatric disorders, because its effect on being able to help you build serotonin, to help you with your neurological help. You know, it's it's not okay to be deficient in this. And if you are someone who is like a vegetarian or more specifically a vegan, you are at higher risk of maybe having B12 deficiencies. So we want to be mindful of that, because it is much more readily available in animal sources from natural products. But if you're a vegetarian or vegan, you're likely to be part of the population that's going to have to supplement. And even animal eaters have to supplement depending on what conditions they're dealing with. Right. So
Yeah. And speaking of conditions, like one of the things I focused on, surprise, surprise, was absorption of B12. And so I'll just quick kind of go over that because it's like a whole gut experience. The absorption of
yeah.
B12 is crazy. It's not like, oh, you put it in your mouth and it gets absorbed through the layer.
No, it's
You know,
wild.
it's wild. So it comes in it comes in to the mouth in the form of protein bound, or maybe in the form of a supplement where it's not protein bound. It then has to bind an R binder. And if it doesn't bind the R binder, then you're not, like, it needs to be shuttled along all the way. It changes boats, really. It goes from like this R binder, and then it goes on to intrinsic factor, and then it goes on to transcobalamin.
Right.
It's kind of wild. So
Yeah.
so what you need to do is understand that the absorption of B12 starts basically in the oral pharynx. So it starts basically in the mouth. And I'm actually, now that we talked about the tongue, I'm wondering if there's some implication there for oral pharynx and the tongue based on
Maybe.
I'm not sure, but basically you need things working. You need to make these R binders in the oral pharynx. Gastric mucosal cells will make R binders, and also parietal cells, which make your hydrochloric acid, will also make this intrinsic factor. So now the B12 is going to be riding on the R binders, and then it's going to hop on to the intrinsic factor, but not right away.
No,
In
it's so
between,
wild.
it's crazy. So in between, so it hangs on to the R binders. Alongside the R binders, it's taking a ride with the R binders. It's going to then be riding alongside this intrinsic factor, which is made up in the stomach. Then they cruise down and they get into like past the sphincter of Oddi, where the proteases from the pancreas have fired in some proteases to now take off the R binders and swap it onto the intrinsic factor. So it's hitchhiking with the R binders, then it hitchhikes with the intrinsic factor, and it goes for a long way. So it's
Yeah.
going for a ride with the intrinsic factor from the duodenum or duodenum, however you pronounce that. And it goes for the length of the small intestine, just hanging out on this intrinsic factor until it gets to the distal ileum, where then it comes off of the intrinsic factor and gets absorbed and attached to transcobalamin 2. and then transcobalamin 2 sends half of it to the liver and half of it to the other tissues. So man, you're going from like, so we got implications from oral pharynx to distal ileum, which is the
Yeah.
majority of the digestive tract. And then you've got implications for pancreatic function. You've got
Yeah.
implications for stomach function and proper acid degradation.
Right.
You've got oral pharynx contributors, and then liver.
And then also, I would also say intestinal integrity too, right? Like if you have leaky gut, if you have gut permeability, if you have damage to anything there, are you going to be able to absorb this effectively as well?
Yeah, yeah. I mean,
right?
you
So
could go on, yeah.
stomach acid, pancreas, enzymes, these different types of proteins, which means you also have to have a sufficient amount of amino acids and proteins so that you can continue to recycle and develop these things. Yeah, there's a lot that goes on.
So a natural progression would be to talk about the conditions, substances that contribute to improper or suboptimal absorption. And you reminded me of this because metformin screws up your microbiome and how things move in the gut. So
Yeah.
metformin, if you're on metformin, you have a way higher chance of being B12 deficient.
Yeah.
Another one, which makes total sense, and most people will know this when you know about the stomach acid component, is that proton pump inhibitors, you're going to have a higher chance of B12 deficiency.
Yeah.
Ethanol or booze, interesting. This one is because of its effect on the pancreas. So, and that was that consolidated my understanding, I think, of the importance of the pancreas and pancreatic enzymes to the proper degradation of the R factor from the cobalamin to absorb it properly, and then SIBO, small bowel bacterial overgrowth, because vitamin B12 is overused by bacteria, leading to B12 deficiency. Because remember, a lot of like vitamins and minerals, it's not just us using them, people. It's currency for life for a lot of different forms of life. So bacteria use it too.
They were talking about that, the Doherty sisters, who we're going to have on the show because they're brilliant. They were talking, and fun. They were talking about this at the conference I was at a few weekends ago. I know I keep bringing it up, but it was quite inspirational, so deal with it. But they were talking about how they are, you can take your oral ones, but again, there's all these digestive things that might be interfering with the absorption of oral B12. So they always go towards an injectable form, especially for the type of population of patients that they are dealing with that really need this to be supported very optimally. But they were also commenting on how bugs will like methyl donors are often going to feed the microbes. So if you are concerned about an overgrowth of microbes, it might not be the most opportune time to give an oral dose per se. That's where injectables might be better, or treat the gut first and then go into B12 absorption. I would also say that for iron, because microbes are often attracted to heavy metals. So iron's another one that I'm careful about. If someone isn't grossly deficient in iron, then I will prioritize working on the gut microbiome first and then go back to iron, and same thing with B12. Unless I think their detox pathways are really bungled up, which will then affect my microbiome stuff.
Wait,
but
are you saying it's important to treat the terrain?
Yes. Who knew? Who knew? So yeah. So but this is where we have to start making choices about the type of B that you take as well, because if your gut is compromised, maybe if I have to boost B12, I'm usually giving something that's going to be sublingual so that there's at least a chance of it going right to the bloodstream.
There's a better chance.
There's a better chance. I don't do injectables because it's not part of the type of licensing that I hold as a naturopath. I haven't gone to get my pharmaceutical regulatory
I won't
license.
comment on that.
So I'm not doing B12 injections as I was able to do prior to all these changes to our regulations. However, the Doherty sisters do have those regulations and they do that. And I took a shot in the butt literally at the conference. I felt supercharged after, thanks to Carissa. But then I also have access to some B12s that are liposomal, and then I will have people hold that under their tongue, and liposomes tend to bypass a lot of digestive issues and bypass the liver, so they can be assimilated a little bit more readily into the bloodstream, or on a cellular level. So I often even just jump right to those for most of my patients, just to make sure that the support gets there in a much more efficient way.
Yeah, so the methylcobalamin and adenosine cobalamin.
Adenosine?
I don't use that one.
No.
But those are the two forms that actually have biological activity.
Hydroxycobalamin also is active
It's
form,
a
but it has
synthetic
to.
form.
No, hydroxy I heard was no, I've looked it up. I was looking this up because I wanted to understand. Hydroxy is still what is an active form. But it's a precursor to methylcobalamin and adenosyl cobalamin, but it's one of the more active forms that you can still find in supplement. And it's better retained in the blood for longer than the synthetic form of B12, which is cyanocobalamin, which also has to be converted. But I find that it's less effective. So usually my go-to is always just the methylated form. And I don't know when I would actually use hydroxycobalamin, especially I think it's often common in injectable forms, but from a supplement perspective, I will always opt for methylation because I find most people's methylation pathways are a bit bungled up. So if I can give them an extra methyl donor, that's usually a good thing.
So I tend to just stick with methyl
Yeah.
in practice, but like you said, the adenosyl and the hydroxy are, they do. I mean, you got to be a real look at that stuff with a real fine tooth comb, like Dr. Ben Lynch would be all about that.
Right.
But really, for all intents and purposes, the average person, I think, is going to benefit mostly from methyl, and these especially methyl and these other forms of the natural forms, they play a role in myelin formation, which we didn't specifically say, fatty acids.
Yeah, I forgot to
Yeah.
comment on that.
Yeah, and that's one of the reasons I think it's really important for any like neurological symptoms. I'm thinking about B12. One simple test you can do is just do that Romberg test, see if someone's kind of falls over easily when they close their eyes. That's a one of the old school physical exam tests that might be helpful.
Speaking of testing, I have often questioned whether or not serum B12 is a great representation.
Can we wait just for 1 second?
Fine.
Before we go on to that, because I want to talk about, because this is still absorption.
I know.
Just talked about absorption. Apparently, about 1.2% of vitamin B12 is absorbed passively without the help of intrinsic factor. So if you get sufficient amounts, sufficient frequency, the passive absorption is going to be enough to sort of like overwhelm those other more efficient pathways, and just like passive diffusion will happen. So like 1,000 or 2,000 micrograms of cobalamin a day might be enough just to orally to get people where they need to be. And like you said, maybe the Doherty sisters don't do it, or if you got SIBO, maybe you're going to contribute to other problems. With what the benefit is, it's damn easy. That's the benefit of taking this oral form as opposed to having to get an injection or whatever. Yeah. So
if someone isn't wildly B12 deficient, then I'm not always just focusing on B12 either. I'm usually giving it in a combination. That's where I like a B complex, because there's a synergy that happens. Even for methylation, you need folate, you need choline, you need trimethylglycine, you need B12 in the methylated form. B6 is important as a cofactor for they all have to work together. So sometimes I find giving that as a complex is also going to help your stress response, and it has an influence on hormonal balancing and regulation. It's going to have an effect on mood and cognitive function, in addition to all the other things that we talked about that B12 and methylation do. There's a whole bunch of other benefits to taking a good variety of B vitamins. So unless someone needs a specific boost in B12, I'm not always giving it in isolation anymore. But like I said, I have a liposomal one that's a spray that's TMG, B12, folate, and B6. So if I'm really concerned about methylation pathways, then I'm usually doing that.
Another thing I see whenever I see B12 deficiency, I usually see iron deficiency. And whenever I see iron deficiency, I usually see B12 deficiency. I wouldn't say it's a 1-to-1 sort of overlapping 100% Venn diagram, but it's pretty damn close. And I would say, like, if you've been shown, through labs or whatever to have low iron, I would be thinking about maybe a little bit finer view of your B12. But maybe that's a nice sense. It would. I mean, look, it would make sense that, okay, if you're low on iron, you could be low on any mineral, and maybe it has to do with the cobalamin. We didn't say that, I don't think, but the vitamin B12 is cobalamin because it's got cobalt in it. So maybe it has something to do with, just mineral absorption.
But I think it also makes sense in the sense of the pathway B12 takes. if your stomach acid is deficient, we've talked about this before, that's gonna affect your iron absorption. If you have a gut microbiome issue, I already touched on that today. Your body might be robbing you of iron because of a pathogen concern. Same with the B12, right? And then our body has this weird compensation effect for iron if there's microbial pathogens. If you're chronically inflamed, there might be some extra demands on the body that your body's burning through your B12 faster. Inflammation is going to block iron deficiency. I'll block iron. So there's some similar, I would say there are some parallels to maybe some common pathways that would disrupt both the absorption of both of those with regards to a lot of common health concerns today. So.
Yeah, no, that's good. You put a few things together there too. And then a couple other signs just for the nerds or clinicians is that you'll get megaloblastic anemia and hypersegmented neutrophils. Those are just things you might see. I think you'll only see hypersegmented neutrophils on a blood smear, I think. So it's like it's not a standard
No, that's not a
thing.
standard
A
blood
pathologist,
test.
yeah, like hematologist, pathologist would probably be the one having to do a smear to see if there's that. But the megaloblastic anemia is common. So that's usually you'll see your RBC values will be above 100 probably.
So
The size of them.
and just talking about diagnostics, if you're curious about B12, then you don't want to just look for serum B12. You want to have a good CBC as well. Maybe check for ferritin as well. But I've often wondered about this.
Reticulocytes.
Yeah. Yes. And you want to look at the size of the red blood cells because, like, again, macrocytic anemia, MCV on your blood work can also indicate a B12 deficiency. The larger they are, possible B12 deficiency, the smaller your red blood cells, likely an iron deficiency. And then if they're still looking normal, but everything else is off, then you might have both. So, but I've always wondered about serum B12 and whether it's an accurate representation of what's actually in the body and available. And I was looking into this and I found one source. And now whether or not this is accurate or not, if somebody can provide me the information, if I'm not correct with this, then please help enlighten me. But it talks about how it's one of the more inaccurate methods to check serum B12 because you're measuring a serum B12 status, but it's going to be measuring both the active forms and the inactive forms. So if you have a large amount of the inactive form, it could still show relatively decent on numbers, but the amount of active forms of B12 is deficient. So technically you'd still be in a deficiency state with regards to what's usable for your body. So it can start to cause some false positives. And then they also said that most reference ranges applied for B12, especially in North America, are kind of like, there's a lot of inconsistencies, but also I find that they are quite low. So we're missing the mark when it comes to insufficiencies or deficiencies because we have such a low standard for B12. I feel like this is a North American thing. It's like we just settle for the bare minimum, where I think in other countries, like our reference range goes from like a 200 or 130 to 650. And I know in other countries, they start at 600 and go into 1,000. So like, why are we so different? So when I see someone whose B12 is quote unquote high on their blood work, their doctor's like, oh, are you supplementing? Stop taking your supplement. And I was like, well, first of all, it's a water soluble vitamin. So if your body doesn't need it, you're going to pee it out. And second of all, I sometimes find that a lot of people feel better when they're above 600. They physically and symptomatically feel better. So I don't necessarily, that doesn't scare me when they're at an 800. I'm kind of like, yeah. And how do you feel?
Well, two things to support what you just said. You said the range, it goes up to it's much higher in some countries. And so who cares what the range is in a way? Because if you feel better, and we know, here's the first point I wanted to say is that B12 is very, very safe. So if you take lots and you feel better, well, that's cool. I don't think anyone's like, the longer I do this job, I think it's probably the same for you. The more you're like, okay, the labs and stuff are great. But I can hang my hat on, but generally, like, what I really care about is the person exhibiting, signs of health and fewer signs of disease, right? So if they just feel better, taking a bit more.
Labs are just a value if they're not in context. And they're helpful, but they're not everything.
Yeah, that was the other thing I wanted to say, is that like labs they're helpful, but the reason, perhaps, Michelle, to tie up, something else you said, is that if it's not a perfect sort of evaluation, because heads up, guys, like very few labs are perfect evaluation of things. They're they're not without their sort of foibles, you know. So like, okay, maybe the person who feels better when they have 700, 800, 900 levels, I think it's like picomoles. Maybe it's because the labs are not perfect. So that's okay. We don't want to go by labs without the context of the person sitting in front of you with signs of health and disease are not so great, right?
Yeah, and
We've talked about that before.
I wonder if there's also a difference between being in a fasted state versus not a fasted state. Does that make a difference? I don't know. Like, I don't know, right?
Well,
So
there's a PhD waiting for you if you want to, look at just like even transcobalamin 1 and transcobalamin 2, which
no
we could go
thanks.
into, but yeah, no thanks. We've decided just to do like 20 minutes of love for B12. I'm sure there
Yeah, we love it.
could be more. We
We
do
love
love
it.
B12. Come on.
We love it. So that was the little thing about B12. Is there anything else we have to? I feel like we covered everything we wanted to cover.
One thing which we may have overlooked, but you indirectly said something about it too, though. I just want to be clear that the main sources are red meat, dairy and eggs. And you did say like if you're vegan, like hardcore vegan, you're not gonna have enough B12. And without, I don't want to be too hard on people who are vegan or whatever, because it's like I understand the sort of spiritual other concerns, but like if a certain dietary regimen guarantees that you'll be deficient in a critical vitamin for life, then it has its drawbacks, and that B12 has got to be one of the main things you got to say about vegan diet, is that you got to be real careful about that.
And yeah, B12 and iron. So I would say, thank God supplements have become better and better. We have more options and they're readily available. And a sublingual lozenge can go a long way for people who are vegan and vegetarian to ensure that your neurological health and your DNA repair and your gene expression and your psychology stay intact, psychological well-being stay intact. Because it's a good thing we have good quality supplements now. It's not, it's in the readily accessible. So thank God. Yeah.
All right.
And they're not that expensive for sublingual B12, to be honest. They're actually pretty affordable.
No, they're not too bad. They're not too bad. So guys, B12 is important, and we're always trying to find ways to make, common lab tests make a little bit more sense and pull in the other possibilities of interpreting labs. So I hope you guys enjoyed that episode, and we will catch you up next week.
See ya.